So hello, everyone, and welcome to the first session of Ask Dr. J Mental Health Questions Uncensored. I hope everyone's really excited because I was super excited to do this for you. I want to be able to have this interactive conversation with everyone in my community because I think that these questions are super relevant and important for everyone to have. And I thought it would be a fun way of us having a conversation about it instead of always getting a messenger answer back from me or something in the Facebook group. I think it's a fun idea to just chat it out and hash it out and have some real life on the spot answers. I have not read any of the questions that have come in, so I do not have any prepped answers. I'm going to read them. I'm going to give you the first thing that comes to my mind, and we are going to have that back and forth conversation. And hopefully by the end of this, you're walking away with a lot of information and a lot of ways to shift and change the experience that you're having right now. So I'm seeing a few questions come in right now through the Q&A box. I'm going to start there first, and then I'll head out into the list that I have already curated from all of you who have sent questions in. My first question is from an anonymous person, and it says, what do you think would be the best way to deal with health anxiety? And I would say that health anxiety is a very constant and consistent thing that I see in practice. I see a lot of people in real life with anxiety and depression that are saying that there's a lot of worry and fear around always feeling like they're going to die or feeling like a twinge in the body is something bigger than that. And there's a lot of time being spent in hospitals and the ER room and just at doctors trying to reconcile themselves with the fact that it is at the end of the day just anxiety and everything is okay. And one of the main things that I always tell people at the beginning of working with their health anxiety is we're having an issue and we're having an anxiety response because we are not comfortable with discomfort. And I know that you guys are all expecting me to say this right off the hop at the beginning of this conversation, but if you have difficulty with the unknown or difficulty with discomfort, then meditation is going to be the number one tool that we're looking at in order to shift and change that. Because what happens with the health anxiety is you think something spontaneous, which could be an intrusive thought of any sort, and then we start to spiral out with a story that's happening. And that happens from a lack of focus in the mind and a lack of focus in staying in the grounded reality of where we are. And I see that a lot with people that have health anxiety is that no one has ever taught them how to sit with their shit or how to say, okay, that is what this one thing is. And now that I've ruled that out and I did my scientific due diligence, I have to let that fear go. And I think that it does come from that ability to not sit with it and not be with the discomfort. And then there's also the part that is the hypervigilance and the anxiety of not being able to stay with the idea that human beings have sensations in their body and a lot of them are normal. So there's that hypervigilance of, oh, this thing is bad or this thing is not normal or other people don't have this. So it's that hyper awareness of normal sensations in the body. So that's where that nervous system work that you guys hear me talk about all the time comes into play, is how do we get you to a place where you can tolerate that discomfort and also be able to integrate the fact that you're a human being who's allowed to feel things and allowed to experience things without them being something catastrophic. So I think that cognitive behavioral exercises can be very, very helpful in this area, but we also have to incorporate the body work, because if we're not able to sit with it and it's always thinking about it or rationalizing or creating logic around situations, sometimes that doesn't tamp down the obsessive or ruminating thoughts that continue on there. So that was my long-winded way of, I would start with meditation. That's what I'd say. That's always my first best bet when it comes to anxiety in general. Health anxiety is no different than regular anxiety, than relationship anxiety, than anything else. I think that we've put this label on it, and then people think that there's a revolutionary answer or a type of treatment for it, when at the end of the day, we just have to learn how to be comfortable inside our own skin. And that's a skill that you can build over time. I'm going to pivot now. First, I'm going to drink because, wow, that took a lot out of me. Okay, Eddie's typing in saying, is feeling weakness like a blood sugar drop a common anxiety symptom? I've checked my blood during those episodes and it's fine. So what would be a good way to combat those symptoms? So I want to start off this question and answering it by saying that blood sugar I would say blood sugar, just because we're checking our levels, we don't have to be in a diabetic place or such a low blood sugar place to indicate having the sensation of feeling the weakness or feeling the anxiety and feeling the fatigue and feeling that change in our body. So blood sugar, taking a frank, prick in the finger, checking in, seeing what the blood sugar levels are at, doesn't always indicate the sensation that we're having in the body. The same way that we can check our blood pressure when we feel that it's really low, but then we go to check it and it shouldn't be astronomically low to the point of feeling those type of symptoms. So it's kind of a catch-22 when it comes to symptoms versus the clinical outcomes that we're looking at. We can't blame blood sugar for that kind of stuff, but we also can't say, well, my numbers weren't so low to cause that, so it can't be related to that. That being said, I've actually taken some thought about this one because I have spoken to Eddie before. And I am curious as to why we think it's blood sugar related. And we can obviously unpack that a little bit further. But I don't think that the weakness, we can point a finger at it and say, okay, it's this one specific thing that's causing that to happen. So it could be blood sugar, it could be hydration, it could be something happening in the immune system, it could be the way that our body is processing our anxiety, right? So we can't just pigeonhole ourselves and look at blood sugar and say, well, I've ruled it out, so what else could it be? Because there are so many other systems in the human body that can be related to that, especially your hormones. Like cortisol is one of the ones that if you have a surge of cortisol and you're coming off that surge of cortisol when you're stressed, you can totally feel weakness and fatigue. And not everyone's going to have that response, the same way that some people are really sensitive to their blood sugar dropping slightly and some people really aren't. And that's why you see people who need snacks all the time throughout the day and other people who can fast for 24 hours and don't have an issue. So I think that that needs to be delved into further. And obviously, I've spoken with you, Eddie, so we can have that one-to-one talk where we are looking at what's actually happening in the body system that could be causing that stuff, so we can start teasing this apart. Okay. So right now I only have those 3 questions in my Q&A. If you have something specific you want to ask, I would go type your answers, your questions in right now so that we can get them answered if you're here with me live. But other than that, I'm going to hop into some of the questions that I got ahead of time. And I will go in no particular order. I'm going to sift through them and see which ones I like the best though. Okay, so I have one here that says, any recommendations for treating nocturnal panic attacks? And what about daytime panic attacks? So most often with my patients, when I'm seeing people having nocturnal panic attacks, we are either looking at such a dysregulated nervous system that the moment that it's dropping into that deep sleep, it feels so unsafe that it's coming out and having that nervous system response and that fight or flight demonstration, or we're often seeing nutrient deficiencies. So the first thing that I would say to look at is make sure that your iron levels are within the proper range of optimal, not just looking at your iron levels and looking at your blood work and saying, okay, well, I'm in range. We have to make sure that we're in a specific range so that we're not having that, I would like to say like that 4 a.m., 5 a.m. wake up to like, oh my goodness, there's like a massive start of your nervous system and we're getting heart palpitations and feeling like the room is spinning. That is very in alignment with the iron deficiencies that I've seen in my patients before. There's also a lot of talk, I would say, in this industry about when people are having nocturnal panic attacks, it's because there's something in the subconscious that is causing you to, when you're in that, deep sleep and you're going into the REM, from deep to REM, that is causing you to come out because you are having a nervous system response to whatever's happening that you're able to access in your subconscious. I would say that's more of a spiritual conversation, and we could, blanket statement and say sleep is going to be shit if there's stuff happening in your subconscious. But if, those 2 areas are both spick and span and perfectly clean, and there is nothing happening with your nutrient deficiencies, nothing happening with iron, and nothing happening in your life that could be causing that, then we have to look, I would say, at the pattern of sleep that's happening that could be causing maybe an intrusion of the incorrect waves that's causing panic attacks, or your nervous system is so primed to already have a panic attack that they are happening throughout any time of day, and having them at nighttime is just an inconvenience, but it's what happens when your body is so used to firing that pathway as quickly as possible. And the second part of this question said, what do you do about treating the daytime panic attacks? I have a live on panic attacks. If you haven't seen it, send me a message so that I can send you the link to watch it. I think it is going to be the most comprehensive way to learn about panic attacks, what's happening in the brain, what's happening in the nervous system, so that you get a good gauge and an idea of what you should be doing to start working on that. And panic attacks are not something that you can snap your fingers and start treating right away, but there are some very good things that you can start doing to regulate yourself to reduce the frequency of them, and then get a better understanding of how to navigate them. Like I know that I posted about this in the Facebook group 2 weeks ago now, but 2 weeks ago or 3 weeks ago on one of my Peace of Mind Method group calls, I had a full panic attack in front of all of my patients. It was stimulated out of, what most would call nowhere, but I am very aware of the things that would trigger me to end up in that situation. And I navigated it with everyone live with me on there. So I think that there is a way to also have these symptoms and be able to sit with them in a very different way so that you are able to experience a very different relationship with the anxiety and the panic and the depression and all the stuff that we all experience. But not all these situations require a spiral, and not all these situations require conventional treatment. Just because we have panic attacks, it doesn't mean we need medication. It depends on where we sit on the scale of how often they're happening and how much effort we want to put into healing the nervous system at the root. And that is where, I would say if you do have panic attacks and you're at that point where you're having panic attacks frequently throughout the day, throughout the night, and they're happening and you have no control over them, even though you're on medication, clearly something's not working there, and we have to go that layer deeper. And that's why I love Peace of Mind Method, which is how I work with my patients on their mental health, because it goes through all of the different areas of where we need to regulate the nervous system to make sure that we're not missing any steps that could be causing what's happening there. And we turn over all the rocks to make sure that we get into all of those corners, and not miss anything, because you can't live like that. We can't live in a place where we're having panic attacks all the time and saying, okay, well, I'll take an Ativan when that happens, because that's not teaching the nervous system how to heal and recover from that. It's teaching us how to blanket over everything and band-aid it and not get down to the bottom of what it is that we're trying to treat at the end of the day. I would say from a treatment perspective, just because it's on my mind right now, because I'm, thinking about panic attacks, very often when I have patients who have panic attacks, we do some work with a type of liposomal L-theanine, because what the research shows for that specifically is that it reduces and blunts the cortisol response in the body, which allows us to engage with the panic attack a little bit better. I know that there's a lot of blogs out there and a lot of people talking about natural medicines that don't really understand the application of how we want to use them. But L-theanine is one of those things where I say it's not as beneficial for anxiety as it is going to be for panic. And the same thing goes for GABA. And you'll see a lot of both of those research, they're bundled together a lot of the time, where we want to be using the right plant medicines or the right natural medicines in the way that they are supposed to be used for the anxiety, depression, or panic or mood symptoms that you're experiencing. And I hope that was clear, because I don't want you guys to jump on the bandwagon and be like, oh, well, I have panic attacks, so that's going to work for me. And that's not how it works. This is a case-by-case basis, but I do see very frequently that when it comes to my patients with panic attacks, I'm very frequently working with L-theanine and GABA in conjunction with each other, because they do have a quick and short acting effect on a cortisol response, which allows the patient that I'm working with to implement the tools that we're working with in Peace of Mind Method so that they can start seeing changes and retrain their neural pathways. It's not a magic pill where you take it and it's like, oh, no panic attack. It is using the natural medicines in the way they're intended, but also doing that work in the background at the same time. If I knew I was going to be talking this much, I would have packed myself 6 water bottles tonight. Do we have any follow-up questions about panic attacks before I move on from that? You can type it in the chat too. It's fine. That doesn't need to be in the Q&A section, but I want to make sure you are all understanding what we want to be doing when it comes to panic attacks. We don't want to be slapping band-aids. We need to really recreate the neural pathway so that our body and our nervous system is responding different to the triggers. but that requires a good amount of effort and a lot of tools. So including like daily practices like meditation and breath work, and utilizing yoga and making sure we're getting optimal sleep and making sure we're eating properly, and doing all that kind of stuff before we ever get to the point where it's like, okay, now we're having the panic attack and navigating how we want to think about things differently and rewire our neural pathways in the moment. I hope that makes sense. James is asking, what if you get occasional rather than constant panic attacks? I would say most people are getting occasional panic attacks. People are not often getting constant panic attacks. If you were getting constant panic attacks, like from what a real full-fledged panic attack is, you would have a very difficult time living. But occasional panic attacks are requiring of the exact same type of approach that I just mentioned right now. Getting an occasional panic attack can throw you for a loop no matter what, at any time, anywhere. And you have to be able, if you're hoping to manage this either naturally or just managing it like, in a very, very optimal and helpful way to approach life so that you're not freaked out about your panic attacks, you got to do the work. And like that does require the daily practices, like I just said, and then working in the moment to de-intensify the experiences that you're having. Like when I was having my panic attack in front of everyone a few weeks ago, I was able to practice my breath work on the spot. I was able to continue the live that I was doing. I was able to still engage with everyone. I was able to step back and observe myself like a third party without it spiraling out of control. I incorporated movement. So there's a lot of different things that we can do in order to move an emotion through us instead of holding it in our space, freaking the fuck out by looking at it and letting it take over our experience. And that is why, again, I know you guys have all heard me say this, but using meditation as a tool can teach you so powerfully how to sit with something and have it be there with you instead of it taking over your entire experience and becoming you. There should be a separation between you, the person who is observing you, and the things that you're experiencing. And if that does not make sense to you, you haven't meditated yet, and I'm very confident about that. Okay. James, I'm going to read one of yours next. So it's, what do you recommend for managing ADHD? And ADHD is one of those diagnoses that I absolutely love and hate because I think it can give us a very curious approach, person to person. Everyone has their different tics and issues when it comes to the ADHD. But it is very challenging because there is the neurochemical component and the neurodynamic component, and then there's the personality component. So when it comes to treatment, I like to tackle all these different things. I like to treat biochemically. So I will do some supplement plans so that I'm helping people at least operate functionally in the best way possible. Because in a neurodynamic brain that's just a little different, we do have to curtail the neurotransmitters a little bit better because we do have some good research to show what's happening in the background from a neurotransmitter perspective. So I do treatment there. Then I also do a lot of behavioral things with people because people with ADHD have different patterns of behaviors, the same way that people with depression have different patterns and people with anxiety have different patterns. So we have to, and I don't love to use the word hack, but you have to hack the system and say, okay, what am I capable of and what are my deficiencies? And if I know what my deficiencies are, how do I build a plan so that the deficiencies aren't getting in the way of my quality of life? So we have the neurochemical side, we have the behavioral pattern side, and then we have the personality component of it. And I think that breaking those three things apart is what's going to get you to the best place possible. When it comes to natural medicines, I tend to focus on DMAE because it has very good research for ADHD. I really like using phosphatidylserine because it does help with neurotransmitter components. And then I will work with some amino acids that help with dopamine because we do know that in ADHD, there is a short-lived dopamine response, which is why people are going for those constant hits and their brain is bouncing all over the place all the time. So that is usually a comprehensive treatment plan for people with ADHD from a neurochemical standpoint. I'm not big on the things that you'll see online, which is increase your brain flow and increase your focus and do all that kind of stuff, because I don't find that nootropics and blood flow is going to ever change the actual pathways that happen in someone with ADHD. So if you are someone who has ADHD and you're on those kind of things and you find them helpful, great, stay on them. I have nothing against that. but I find that I often speak to people who have ADHD and they're not working in the right territories for us to see success in that area code. Plus ADHD comes along with a lot of mental, emotional stuff and, anxiety and depression and mood disturbances that I think have to be addressed more frequently than the ADHD itself, because there are ways of working around you sitting and having a focus on something. Not everyone has to live like that, but I think that the deleterious effects of ADHD most often come from the mental, emotional side of things. So there is going to be a comprehensive approach regardless. Does anyone have any more follow-up questions about ADHD? Because I know that this is a whole other topic that people could probably spend an hour talking about with me. I like this question. I don't know who sent it in, but I'm going to read it and hopefully you're here. Someone wrote to me, anxiety comes out of the blue. Why would it suddenly appear? I was fine for years with only the occasional small panic attack. In the past 6 weeks, I've had the worst anxiety I've ever experienced, and I've been experiencing days of anxiety, and then I'm fine for a few days. I think I've solved it. Then bam, it's back with a vengeance. Can I first get like a hands up if that's you, if you've literally said to yourself, oh my God, this came out of nowhere. And I say that in such a hilarious tone with my voice because it's just not fucking true. I think that so many of us say, oh my God, it came out of nowhere because we've turned a blind eye to all the signals that our body and our minds have been giving us for so long. And at some point, the body has to fight back. And that is what the anxiety is. And that's what the panic is. Like when people tell me they have panic attacks out of nowhere, I'm like, do you know how crazy that sounds to me? How could it be out of nowhere? It had to have come from your nervous system, and it had to be a massive response of the body to shake you up to say, fucking listen to me. Okay. So there is no such thing as anxiety that comes out of the blue. In this case, and honestly, everyone here, which is why I can say this, we've all had anxiety our entire life, and we have to come to terms with that. And then we have to say, okay, what is contributing to my anxiety? What am I doing to take care of the nervous system underneath that? What am I doing to take care of the hormonal plane that's happening beyond that as a cascade to what's happening in my nervous system? If you don't have simple answers to that, of what are you doing about it and how are you contributing to it? And, what are you working on to get to that next place? Then of course your body's going to continue to have anxiety and continue to have panic. And there's this thing that I see people do, especially high achievers, where we try to rationalize everything in our brain. And we're like, okay, I've figured it out. I have figured out the reason for my anxiety. I know my triggers. I know why that happened. Why can't I make it go away now? Because it doesn't matter how much you talk or how much you say to yourself, I'm fine. That makes sense. We're good. Right? If you take a kid's ice cream away from them, what do? Someone just answer very quickly. They cry, right? You take the kids' ice cream away and they go, and you don't look at them and say, you're fine, you're good. You don't need the ice cream. You're fine. Move on. The kid's still going to sit there and cry, right? Is this landing for you guys? The kid's not just going to look at you and go, I'm fine. I don't need ice cream. We're good. It's not going to happen like that. So we have to recognize that our existence, our human existence, our bodies, our personality, our mind, it's not just going to respond to the fact that we've figured it out. Figuring it out means fucking nothing. And I say that with a smile on my face because I did the same shit too. I used to say like, okay, this makes sense. I shouldn't be mad about this anymore. I shouldn't be anxious about this anymore. I shouldn't be depressed about it anymore. And it doesn't make the feelings any less. And I think that that is where, like, when I hear someone say it came out of nowhere, we have to recognize that there is a massive disconnect between the head and the heart and the nervous system and how we are integrating ourselves as a human being. And it takes that moment of self-reflection to look back and go, okay, I am doing that. I'm missing all the steps in between. I'm trying to emotionally bypass or spiritually bypass all the things that are happening inside my body. And you might, at this point in your journey, not be able to look at yourself and say, okay, yeah, that makes sense. All this stuff is going on. You might legitimately not have the insight into yourself, and that's fine. But that's where, when you have these conversations with people, that you can start to tease it apart and break down what things are actually contributing to the nothing, or that are contributing to the nervous system getting up to the point where its tolerance or its max breaks down, and then you start to experience symptoms. So that is, when I hear people say that, I hear it screaming immediately, is there is a massive disconnect and we are out of alignment, and we have to get those two things back on the same page and starting to work on getting yourself to see things as they are. And that's all I can really say, is there's no such thing as things coming out of nowhere. And if you've never spoken to someone who can help you break that down, that's a first step. I'm happy to do that with you. I'm sure there are loads of you in here tonight who have had an anxiety and depression breakthrough call with me. And I am never short of being so blunt and honest with you and saying, what are your thoughts on this? And then we have a fun back and forth, and we see how you're missing some blind spots within yourself, which we all have. And it's totally reasonable to have them, because again, we all do, but we have to have someone outline it to us for us to have the self-reflection moment and go, okay, that makes sense why that's happening. All of this is answered in the nervous system. And we have to learn it at our own pace. And that is the sad truth at the end of the day, is you guys are all like perfectionists, fast moving, high achieving people who want to get your shit done and move on and figure it out. But the body doesn't work that way. And the faster you come to terms with that, the way smoother this healing journey is going to go. Like, if you want to practice radical acceptance, practice the fact that this is not going to work that way. And that'll get you even one step closer to saying, okay, where is my work better done? Instead of wishing it away or rationalizing it away, because it'll always come back with a vengeance, because it's trying to communicate to you. Okay, let's go on to the next one. Okay, someone sent me this one and I like it. What do I do about the lump in my throat that won't go away, or the tight chest? Can I hear from you guys in the chat if you are someone who gets lump in the throat, or like a physical symptom that's not going away and you're like freaking out? Type yes in the chat if that is you. I'm seeing hands fly up. Liz goes, lol, me thinking I'm dying. Okay, so I would be very confident to say that the lump in my throat was the symptom. I'm going to get close to the mic for this one. That fucking sent me. Okay. When I got lump in the throat, I was unhinged and unwell. And that is what sent me to like all the doctors, like sobbing all the time, panic attacks all the time, freaking out, because I legitimately thought that there was something wrong in my throat and that no one was ever going to figure it out. And I was going to be stuck with this forever. And I was actually going to die. There were days where I would sit and like hold my skin away from my neck, because I'm like, I need more space. This is going to make me feel better. I can't get rid of this. And I did that for a very long time. However, after all of this work I've done on myself and my body, it is very, very, very clear to me what is happening if you have this throat symptom. And it is that the anxiety in the body and in the brain is going to show up in our muscles, right? So some of you will get abdominal pain. Some of you will get shoulder pain. Some of you get back pain, hip pain. We have pains, right? Okay. The neck and the throat is the same thing. And the thing that makes it really, and I'm sorry to swear again, but it really lands the point, but this is the thing that's really fucked up, is that a lot of us carry anxiety in the jaw, in the neck, all down here. Okay. And when you're sleeping, if you're someone who grinds your teeth, if you're someone who does this a lot throughout the day, if you're someone who even catches your face like this a lot when you're doing your work or when you're just sitting and watching TV, the anxiety is causing, or the depression or whatever's happening is causing the facial muscles to respond that way. And the facial muscles are going to tighten up and cause that physical symptom either up here in the throat or down here in the throat. And we cannot forget that that is a body symptom, the same way that chest pain is, or the same way that hip pain is. And a lot of people will go to physio and say, my back's hurting or my hips are hurting. And then they start to realize over time that it does have a mental emotional component, but no one is contributing in their head. They're not thinking that this could be very related inside here too. So what I started watching over time was when it was flaring up for me, when it was going away, and what I was doing in order to get rid of it at the time, how long it would last and that kind of stuff. And as time started continuing and it kept coming back, I'm like, this is just so crazy. I have to figure out what this is. And I was like, I need to stop thinking that this is related to something inside. Like, it needs to stop being related to my emotions. It has to stop being related to my stomach acid. I just have to take this for what it is and deal with the actual channel inside my neck and my throat. And when I started focusing on the neck stretching and the gua sha of my face, if you guys have not done my massaging of the face with the gua sha and the neck, or the neck stretches that I do for the vagus nerve, please send me a side message so I can get you this video, because it changed the entire plane of my neck and my throat. And in the last 10 years, I've only had that symptom twice. Okay. And that is crazy because I had it for so many years and it was taking up a lot of my quality of life. Like, I couldn't focus on anything because I always felt like my throat was closing. So if this is you who has that physical symptom there, I really want you to start with those 2 videos that I just mentioned so that you can see how related the anxiety is to holding muscles in the neck and the throat, and how you can actually play a role in doing something about it on a daily or at least multiple days per week basis, instead of going to a practitioner once a month and saying, help me with this thing. That's not preventative. When we talk about treatment for ourselves and we're talking about our bodies, we need to play an accountability role. And that means you need to be involved in doing this consistently. Okay. I just want to check my phone for a second because I got a Facebook message and it makes me worried that one of you can't get in here. Okay. No, you guys are just messaging me because you want the videos. Amazing. Great. Okay, good. Back to the next question. I'm actually going to pause these for a second and I'm going to go back to the Q&A because I'm seeing stuff come in through here. Okay, someone anonymous. My anxiety does not just appear. It happens over time and in the morning, or sometimes it's much worse, but I'm okay through the morning at work. And then I do a check-in with myself and realize, holy shit, I'm in an anxious state, just moving along so quickly that I haven't noticed. And then it gets worse because I've noticed. I don't know what to do. And some days it's bad enough to use an Ativan to get me out of it. I would say, if you are waking up every single day with anxiety, like, yes, you're going to have to do something to work on it aside from recognizing that you have it. And mindfulness is a very interesting game, because I always tell my patients in Peace of Mind Method, when we start practicing mindfulness, I say, yeah, wait, it's going to get worse before it gets better. Because when you start paying attention to everything, I don't even know if this is cool to say anymore, but your anxiety is on fleek. Okay. When you start to see stuff happening inside your body because you're now aware of it happening, it's like a inception anxiety. Like, you're doubling down because now you're recognizing that you have the anxiety and that you have no control over it. And then it's like spiral. Okay. So again, working on your nervous system on a consistent basis so that you are not getting there is the absolute key to doing that. And mindfulness and checking in is not going to be the only way in order to slow yourself down. Now, I'm trying to read as I'm talking, but when you say that you realize, holy shit, I'm in an anxious state and moving so quickly and you haven't noticed, what do you do to reset yourself and bring yourself back? Or do you just go down the spiral? So the tools that we're using in those moments of mindfulness, that's everything. That's actually activating your nervous system in real time in the way we want it to be activated. So if you don't have tools to do that, and the only tool is grab the Ativan, then that's going to be something that should be in a future goal for you is, okay, I need to build in my daily practices, and then I need to build in my real-time nervous system regulation practices so that I know how to navigate this better, instead of just doing the roller coaster of living your life every single day and waking up and going, I hope it doesn't happen today. And I hope it doesn't happen tomorrow. That is not a way to live. Jody, what's the optimal levels of iron you'd recommend? Are you just referring to hemoglobin? No, I am not. They're going to check your ferritin levels in your blood when they do your blood work. I don't know if you're in Canada, but usually we want to see those levels in and around that 40 mark or higher. Depending on where you live, the measurements are going to be different because we have different metric units. So I would say, if you have your blood work and you know what it already is and you want to shoot me the number and be like, what are your thoughts? I can, look at it, and I can't really tell you anything about what I would do for it, but I can say that needs to be worked on or not. That's what I can help with. Okay. Chris, do you help or deal with people who have OCD or any kind of obsessive nature or BDD? Yes, I work with a lot of OCD patients, and that's because a lot of OCD patients have anxiety as well. So I've worked with a lot of people who have mental OCD, and I've worked with people who have physical OCD. I'd say more often people come to me with mental OCD though, or they're coming to me with an anxiety diagnosis and we realize that we're actually treating the wrong thing. And when we start getting the treatment right, that's when we start to see symptoms shift. I did a live replay, I want to say 2 years ago at this point, maybe it was last year, maybe it was 2 years ago, with one of my patients who did Peace of Mind Method, who had OCD, and she had physical and mental OCD, and we worked on both of them, and with on top of the anxiety. So we treated the anxiety, but then we also treated the OCD specifically, and there was massive changes when we switched the treatment. So yes. Do you know anything about sinus bradycardia, and can it be caused by anxiety and panic? My heart will get tacky, then it will go to the low side to where at night I can barely sit down because it gets as low as 50 and I feel like I'm freaking out. But my cardiologist says everything is normal. We love that when a doctor says you're fine and you go home, you're like, I'm not fucking fine. But yeah, I've worked with patients who have issues with heart rate regulation. I've had patients who have blood pressure regulation issues. These are all regular vital signs that are being regulated in the nervous system. So I've seen it all. I've worked with it all. At this point, you're probably on a medication. Confirm or deny. Let me know by maybe writing back inside the Q&A box because you are anonymous. But it's nothing I haven't seen before. And there are ways to regulate your heart rate without using medication. I would say it depends. It depends how unsafe your heart rate is getting. That would be when we rely on medication to make sure that our heart is functioning properly. But if it's just, your heart rate climbing and dropping and you want to do it naturally, there are ways to do that. Okay, Jody, I see you coming back and saying I'm in Canada. So yes, that would be the number that we're looking around, would be 40 for the ferritin levels. Your hemoglobin is what's carrying oxygen. It's not totally relevant to, the exact iron stores in the body. You can also look at your MCV number in your blood work, and MCHC can give you some answers to see as well. I know I'm speaking gibberish to you right now, but if you look at your blood work, you know what I'm talking about. It's in the top section. What do I suggest if you realize something or someone triggers you? Not to get triggered, but to bring the anxiety down. That's where I use my nervous system regulation tools. There are times, and I also got this other question, so let's kind of address it now. There are times where we want our nervous system to be responding to something because it's trying to keep us safe. And we never want to turn or regulate down our nervous system too much to the point where we are not able to respond to things because then we die, right? We need it to be there as an active part of our brain so that we are responding accordingly. When it comes to triggers, I guess it would depend what trigger you're working through. It would depend on where you're at in your journey of what you're working on and how you are regulating yourself in the moment. But that, for me personally, that's where breath work becomes a huge component of what I'm doing. Because if I'm getting emotionally activated, which is, I would say, one of the biggest symptoms that I get when I am in fight or flight and I have high anxiety, I would say I rely on my breath work very, very heavily in order to regulate myself in the moment when I'm getting triggered, and then to bring myself back to a homeostasis or a balance when I'm outside of that space. Because I'm not at that point in my life where I'm going to allow that trigger or that thing to cause any havoc on my nervous system past the point that it's happening. So I'm very diligent on that. I'm seeing someone write back, I'm only on Xanax. You're only on Xanax to regulate the heart rate? And that's the same person that I'm answering back to, correct? If you're only on Xanax to regulate sinus bradycardia, I hate to say this while I'm being recorded and live, but I have no fucking idea what this cardiologist is doing. Or the doctor. I don't understand. I'm going to wait back for an answer. Okay, I'm going to go jump over to the chat so I can see what's happening in here. Okay, Eddie, I want to respond to this one. It says, sometimes I'll be chilling and then a symptom or sensation will hit and then everything turns into shit. Well, that's really good that you're in peace of mind method then, because we're going to work on this until that turns into shit. Because that is the exact definition of what it means to sit with your shit. You can feel something. We can feel things all the time. I can feel my heartbeat in my chest and go, okay. I can feel my stomach hurt and go, okay. It's that downward spiral of how we are perceiving ourselves and how we sit with our discomfort that changes our entire lives. And I think that this whole conversation, can be just based on the concept of how do we increase your tolerance so that those small things that, that really technically should not be even within your awareness or bother you, how do we allow you to tolerate it better? Because what's happening inside your brain from a scientific level is that we have a part of our brain called the thalamus, and it's supposed to be sifting through all of the bullshit. It filters through everything and it tells us what we need to be focused on in order to be a functioning human being. And sometimes the wrong signals make their way through. And I think that when we, especially, I know I'm going to keep coming back to this, but practicing meditation, it really allows us to snap the focus back in that area of our brain and say, we're not going to allow that thing to come through the filter because we don't require it to. It's not necessary right now. And there's like a higher part of your brain that goes, we don't need that. And I think that that is what it feels like inside your body and your brain when you increase your tolerance, that those simple things just start to shift their importance. The same way that when you're a kid and let's say you're a kid and you have like the love of your life in grade 3 and you're holding hands and everything's amazing. And then like they break up with you and date someone else 2 hours later. And they're like, you're not my girlfriend anymore. And you're like screaming and crying in the washroom. And you're like, this is the worst day of my life. And you look back as an adult and you're like, huh? Like that was just non-existent. I recognize that was a big deal back then, but it is not a big deal in the now. And I think that with anxiety, we also graduate with that as we learn the tools and we get more mature inside those areas of our brain, that we get the choice to pick what is going to take us down and what we are going to let go. And I hope that analogy slapped for so many of you. I'm just going through the chat to see what you guys are all saying. I like this heart flutter one where people like get really obsessed with their heart palpitations, because I can give you like really quick advice for this one. I've done a little excerpt of a story on it before. How many of you get heart palpitations and immediately start freaking out and then your heart races faster after and you get more palpitations? Just raise your hand, send a thumbs up on the screen. There's my thumbs. The fastest way to get rid of that is to take a deep breath and sigh out and move on. And I know that sounds so silly. Like, why didn't I think of that? Why can't I just stop panicking? Because you are actively, when you feel the heart palpitation inside your chest and you start freaking out, you start to change your breath rate, which is why the heart palpitations continue and why the heart rate increases, which makes you freak out more. If you can actively feel the heart palpitation and go, whoa, that was weird, and actually move on, there will be nothing else. There's no repercussion. That's immediate real-time nervous system regulation. If you start overthinking why your heart did that, that is a battle you will lose every time, because I can almost guarantee that I am the only person in this live right now who knows how the heart works, who knows how the heart transfers blood from each ventricle and each atrium and how it gets out to each muscle and how it comes back and what nutrients it passes on and what nutrients it grabs. So why are you guys trying to sit there figuring out why this has happened to your heart? It's like the unanswerable question that you're asking yourself. So it's almost better to just go, whew, that felt weird, blah, 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 moving on, because you have no choice. You can't change it. You can't fix it. You don't even know what's happening. So you have no choice but to move on. So I don't know if that kind of clicked for you in your head of like, wait, I am trying to figure out an unsolvable thing. You don't know the answer. So you're just going to have to figure out how to neutralize it and move forward. And the fastest way to do that is by breathing out as hard as you possibly can. It's the same thing as like, and I don't know if you guys have ever heard this before, but if you ever feel like you have chest pain, and I'm going to take it to the nth degree here, but if you feel like you ever have chest pain and you're having a heart attack, the thing that you're supposed to start doing is cough as hard as you can, because it creates pressure in the area and it can jumpstart the heart back to getting out of where it is. the same thing applies. If you feel something in your heart, apply pressure, move on. You can't change it. If you have a pain in your arm, you have control over it because it's not smooth muscle. You can move it around. Like you have active control of this muscle. If I say stretch my arm, I can stretch my arm. If you say to your heart, beat right, it can't beat right because there's no connection from your actual thinking brain, your prefrontal cortex, into that heart muscle. It's just moving by pure rhythm and stimulus in the nervous system. So you don't have control over it. So you have to actually relinquish control when it comes to that. That was a huge segue, but it felt relevant. Trish is wondering if her hot flashes are anxiety driven. I mean, I would say people in menopause who are experiencing anxiety or any mental health condition usually have a more difficult menopausal transition. So yes, they can be related, but hot flashes are anxiety inducing for the best of folks. So I wouldn't look into it too much and say, are they anxiety driven? But I would look at it and say, my anxiety is contributing to making my symptoms more intense. Because at the end of the day, the same theory applies. Sitting with your shit. You have to be able to sit with the discomfort. Having a hot flash is uncomfortable, but also so is sitting in a sauna much beyond you should be sitting in there and you're starting to get so hot and you feel so uncomfortable. But the thing in the sauna is that you can just step out of it. When I'm in that situation, I'll just sit in it and go, this is an interesting challenge. So I think that it really comes down to perspective at the end of the day. And how you sit with yourself and where you let your mind go, because that mental strength is a huge component of all of this. Carolyn, I want to read what you're saying, but I want to understand it better. Flutters, dizziness, pain in a lot of different places, and a lot of crying. Are you referring to what I said earlier about where the pain is in the body? I'm a wreck all day, every day. I need help ASAP. Okay, so send me a message. Let's fucking get you help ASAP. Why are we waiting? These are all physical symptoms that can be tackled and worked on. James, I just got your note about the gua sha massage. Can you send me a note on Instagram so that I have it in my inbox and I can send you the video straight to your DMs? Thank you. Okay. Jody is answering Trish here and saying that she gets really hot and then really cold when her anxiety is high. I get absolutely freezing and my body will go into a freeze response, quite literally. I go freeze collapse. I will get freezing cold. I will shake and I will start yawning. That is a very, very common response inside the body. So if that's you, there's nothing wrong with you. Nothing bad is happening. Your body is going into that survival mode of trying to say, okay, there is a threat and I need to activate and mobilize myself in the way that my body is used to doing. For some people, it's running and fleeing. For some people, it's freezing and shutting down. For other people, it's like getting super aggressive and puffing their chest and getting big. It really depends on who you are. Trish just wrote in, I'm having a hot flash during meditation. It happened and I failed. Yeah, it's difficult. Doing anything in meditation is difficult. Having a thought when you're meditating and being like, don't think about that thought is difficult. So, I mean, meditation is going to be the gift that keeps on giving. And that's why I built the accelerated meditation mini course so that you could all have a sick taste of what that's like. Okay. Someone wants to know, what do I suggest? If you realize, oh no, I already read that one. Dr. J finally managed to log on. Welcome. I know I may have briefly touched on this. Can alcohol cause anxiety and depression? Yes. I feel as if I've used this for such a long time for stress relief, and now I've started to cut back on the alcohol, and I'm wondering if this lightens symptoms. Depending on your alcohol use, alcohol can cause the residual anxiety and depression after use, but also the anxiety and depression can be the thing that's causing you to use the alcohol to tamp down the sensations and the thoughts that are happening in your head. I am sure that we've all had a drink and been like, wow, that thought doesn't even bother me anymore. That's the point of it. It is a numbing agent and that's what it does. However, if you've been consistently drinking for a long time, and you stop drinking, obviously there can be some medical things that get in the way physically of the withdrawal. But also sometimes when we come out of that haze and we start to feel and experience those things that have been pushed down for so long, it can be an anxiety inducing experience. So I would just say, make sure you have someone who you're working with. Are you okay? My dog is just having a hard time down here. I would say make sure that you have someone who's working with you so that you are able to strengthen your tolerance level from that nervous system and that mental health perspective, so that when you stop drinking or you pull away from it, that you are able to tackle the things as they come without going the path of least resistance and then heading back to the thing you were trying to quit in the first place. Okay. Chris, can you go quickly through the differences of anxiety or an OCD diagnosis? I feel I may be misdiagnosed. Okay. Are we talking physical OCD or mental OCD? Can you like clear that up for me first so that I don't give you a full tangent you don't need? Jody, is everything from the mini courses included in Peace of Mind program? I would say that I want to say confidently that every single person who's done Peace of Mind method since the mini courses have come out have also done the mini courses and have also learned new things from doing them. So it's not going to be such a massive overlap. There's going to be some things that are similar that you're learning, but there's a very different integration when you're working in the full program versus when you're doing the mini courses. I think the mini courses are amazing to start learning the tools and techniques that you need to know. I throw everything at you super fast and I want you to learn it. But the difficulty I would say that is most often seen is the accountability and the long-term use of those things. That being said, I've seen people do the mini courses and months later are saying to me, I'm still practicing my breath work and my meditation. So like rock on. Those people obviously have a very high motivation level and are very consistent and are very, they want to keep doing what they're doing because they're seeing the results of working on it. But it just depends on what needs that you have and what you're looking for. I think the mini courses are a great place to start, but also Peace of Mind method is going to give you everything that you need in those different area codes. So it just depends on if you want to do the whole program and learn all the things and do the extra stuff, or if you just want to start small. It's very, very personal. Andrea wants to know, is it anxiety when you can feel your pulse beat? I can feel it. I mean, I can feel my pulse beat everywhere in my body, which means I'm alive. If I put my hand on my pulse right now, I can feel it. If I put my hand on my heart, I can feel it. If I put my hand on my stomach, I can feel it. We have blood vessels everywhere. I don't think that feeling your pulse is it's a human experience. And I'm going to bring that back to what I was saying earlier. A strong beat's a strong beat. I can feel my heart. I can feel my pulse everywhere. Our pulse is meant to be felt. Some of us lay down at night, we lay down and you can like feel it, right? So, I mean, there's no measurement in medicine of what strong is versus not strong, unless we're talking about someone who's literally lost a ton of blood. You can't say that someone has a strong heartbeat based on feeling it, because we should all feel a heartbeat in all the different areas of our body, because that's what circulation does. It's a pressure system. Blood's not... I love a science lesson that's so impromptu. Your blood doesn't have like feet on it and it's running through your body. The reason that we feel a pulse is because our blood vessels are contracting, because they are smooth muscle that is on the vessel lining. And that's what's causing the sensation of a pulse. Depending on what our blood pressure is, that can dictate if something's too high, too low. But there's really, the only time that we're ever really worried about strong, weak heartbeat is if we're losing blood. And you're still here typing to me, so I don't think we're losing too much blood right now. So I wouldn't turn a lot of your focus and attention there. But I can understand that, if you're dealing with anxiety, this is a question that will come up, and it's worth having these conversations to get educated about. Because if you're sitting in your head thinking, oh my God, is that a strong heartbeat? I think it's a strong heartbeat. Do I need to go to the hospital? Is your heartbeat like this? And you start spiraling. If you don't have anyone to explain it to you, which I can guarantee you that when you go to the hospital, no fucking doctor is explaining this to you, which is exactly why I'm having this live right now, so that we can have these conversations back and forth. But you have to recognize that the thought turning into that spiral is the anxiety symptom. It's the anxiety running the show. And we have to get between that, because it's not reasonable. I'm going to say this 100 times tonight. It's not reasonable to live like that. We can't live by having normal human bodily functions and being like, oh my God, right? We have to be able to vacillate. We have to have good days, bad days. We have to have strong heartbeat, soft heartbeat. We have to have, and I'm sorry to say this, like, you know, some days constipated, some days diarrhea, some days great poos. You have to be able to adjust to these different things and not think that there's something wrong with you, because we're human and we have to be able to shift and change and mold and go with the flow and respond to the negative thing and, you know, be healthy and powerful when everything's going great. We have to have the ups and the downs. When you guys have a cold and you get a stuffy nose, you're like, oh, I'll just like take it easy today and stay in bed, right? It's something that just, you know, it's a colloquialism. I'm sick. I need to rest. I need to do this. And I'm expecting that. And there's something about anxiety that just takes everything out of control. Like, it's almost like you've never heard of a cold before and suddenly your nose is stuffed and now you think your nose is falling off and there's a tumor in your nose and that's what's blocking it. It is that irrational. So we have to say, okay, that is not something that I want us to come to, and I'm going to start working on it because it's the right choice at the end of the day. I want to read some of the stuff that's happening in the Q&A right now. I apologize. I totally came out wrong with the Xanax. I'm currently waiting for a phone call from my cardiologist with a follow-up from the ER just a few days ago where the sinus bradycardia keeps popping up on an EKG, but my prior tests were all normal. Then at this point, you're going to have to wait until that doctor gets back to you and decides whether or not they're putting you on a blood, and it's going to be a heart rate regulator is the medication. Is probably going to be some sort of beta blocker, or it's going to be something that's going to regulate and lift that heart rate a little bit better, if that's what's happening. Because if we have issues with the heart and they are functional issues with the heart, we have to treat that. Because if we have a low heart rate all the time, obviously we're going to feel fatigued and dizzy, and we're going to have those anxiety symptoms and feeling like our muscles don't have enough oxygen. We're going to have air hunger because we need our heart rate to be in a certain spot for it to be in that healthy range and not causing physical symptoms of anxiety. But that doesn't mean that the heart rate is causing the anxiety. They can be totally separate. So teasing those apart and doing that treatment, whatever it is with the cardiologist, is helpful. But, you know, working on the mental health stuff on the other side of things is also good. Andrea, did I already answer your question in the chat, but now I'm seeing it here? Okay. Okay, good. Trish, I meditate daily for 15 minutes. I do your chill 20-minute yoga and try to fit in breathing exercises, but I find I still get dysregulated around the same time every day. What am I missing? All of the next steps. Does it just take time? I try not to get discouraged, but it's hard to stay motivated. And I want to tie this into the other question that Jody said about, is it better to do the mini courses or is it better to do the full program? And that's the difference, is you can do these small little techniques here and there, and they can be helpful, but they're only a small portion of the picture. When I do Peace of Mind Method, we have 12 different modules of 12 different things we're learning. We don't just do meditation, breath work, stop, have a nice life. And I know that not everyone can tackle everything, and that not everyone wants to tackle everything. And that's why the mini courses are built, so that you're not biting off more than you can chew. But that is just the beginning of stuff. Eddie, do the full program. We have to do the different steps to make sure that we're turning over all the rocks. Like I mentioned at the beginning, we can't put all of our eggs in a nervous system basket. The same way that we can't put all of our eggs in the cognitive behavioral psychology therapy basket, because then we're missing parts of the picture. So we just have to, step back and say, okay, these are my strengths. These are my weaknesses. This is what I know. This is what I don't know. And then diving into that next place. Plus, and I know I talk about this in the masterclass a lot, but I was doing all this shit too for a very long time and not seeing any results. Like, I was doing the breathing, I was doing the meditation, but I was still like a coo, 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 coo. And you have to do all the different things and then find out what is really sitting at the root of that. And finding your people who understand you and being able to get into those layers and look in those blind spots with you is very important. And I know that you're seeing a therapist, and I hope that they do wonderful work with you. And I'm excited to see where you go next with that. Yay. Okay, Chris, mental OCD. Okay. So a lot of the time with mental OCD, what I see people doing is they become super obsessed with a thought and they ruminate about it. And what I would describe it as is the people are trying to pinpoint and put their finger on something to get the right answer or the right way, or like the most perfect, or like getting satiated, but it's an insatiable need that can't actually be met. And it is very difficult for it to get diagnosed because it just looks like you're a perfectionist, or that you're stubborn, or that you are unable to like wrap your head around concepts. But it does have to do with that inability to let go of the unanswerable question, or the unanswerable, you can't find the solution to the thing. So if that's something that you're experiencing, and you are also noticing that it's taking over, I would say, you emotionally. So when you are in conflict with someone, or when you are trying to think about something, if you can't get there, if you get really irritated, if someone blocks off what you're thinking and you feel like you're going to have an emotional outburst, that would be very hallmark of the mental OCD type of things. And it is very based in that rumination and the inability to let go. So, we can talk about that on the side so that we can, brainstorm some ideas. But I have worked with people who have that. And I would say I have 3 active patients right now who are working through that. Trish, do you suggest the use of multivitamins? Not very often. I do not often use multivitamins in my practice, just based on the fact that there's other things that we need to be taking. I see a lot of the times people are already taking multivitamins, which is great. People who have pretty good, nutrition, and they're eating from different food groups. I don't see a lot of multivitamin style nutrients deficient in what they're eating. So I'm not so big on that, especially when people are coming to me for treatment of specific symptoms. If there's a symptom that's going to match a nutrient deficiency, I'll make sure that we are covering our bases in that area code. Or if someone tells me that they're eating very poorly, sure, fine, let's add it in. But I also don't want people taking like 15 to 20 pills a day, because that can get really overwhelming for a lot of people. And I don't think that multivitamins always have to be included, because they're not always going to give us the result that most people are looking for when it comes to a treatment protocol. Doesn't mean they're bad, but I do find that most multivitamins on the market are expensive pee. And I'm going to say that with a smile and move on. Okay. So this is a funny one. I don't know if it's going to end up funny, but I'm seeing it funny now. Knowing that you know so much being a doctor, do you ever regret being a doctor? I'm a nurse, and ever since I've been working, my health anxiety has been through the roof, and every symptom that comes up, like you mentioned earlier, makes me think about the worst possible diagnosis. I get in the rabbit hole of going onto Dr. Google, which I know is the worst possible thing. Then I go into a spiral, like you mentioned earlier. What do you think is the best way to do meditation while working? This conversation just pivoted back to meditation, but I'm going to go to the first part first. When I was in med school, I had a very high level of health awareness. Health anxiety, sure. Definitely it can make my brain go to the worst possible case scenario, but it also tamps it down, because I know the odds, I know the type of testing that I need next. I know how to navigate it. And I know what are the red flags that I should be looking for. So as a doctor, I would say I'm actually less likely to have any anxiety about it, because I understand the science behind what I'm doing, and the likelihood ratios. So I think that the more knowledge you have, the better that it can get. But it also can lead me down to thinking, oh no, what if it's this? But I also have the skills and tools to know the red flags to be able to rule it out. So kind of, but kind of not. Don't go on Dr. Google. Dr. Google doesn't know how to give you the red flags. It just knows how to give you these basic brush terms of something and saying, by the way, you might have cancer, and go to your doctor. And then you freak the fuck out. This is why we don't Google stuff, because you guys don't know the red flags. You don't know how to rule out. You don't know what differential diagnoses we should be looking at. So that is why we have professionals who do this. And that is exactly why I'm doing a live like this right now. This is why we get to have fun together. What do I think is the best way to do meditation while working? I want you to clear up what you mean by that, because there is no such thing as doing meditation while you do anything else. And I'm very strict on that. Okay. Do we have any other questions for anyone who's live with me right now? Because I do have a whole other list of questions, and I feel bad not answering them. So I'm going to try and go through them fast. Okay. Someone asked, what anxiety calming methods do I recommend when experiencing symptoms? Which ones do you recommend when not experiencing symptoms? This is where I'm going to send you to the masterclass. And also this is what the entirety of Peace of Mind method is about. So I don't even think I can unpack that right now. Some of you also sent me very long stories that I don't think I can do right now. Okay, someone sent me, with the supplement industry not being FDA approved. Yikes. How do you know which supplement companies to trust? And this is where I love using FullScript, because all of the companies that I know have products that are put onto this website. So all of these different companies get approved to get put up onto FullScript, where then I get to go through all of the companies and pick the ones that I like based on the dose and the type of natural medicines they're putting inside each supplement. And if you go into my FullScript store, which, you know, I've put as a link in the Facebook group, I won't be able to grab it right now because I didn't think anyone would ask about FullScript tonight. But that is where I have all of my favorites when it comes to all of the supplement companies and all of the particular supplements that they are selling. So if you want more information on FullScript and how to pick companies that I like, then send me a side message so I can get you that link after this. And I think that that'll get you to the answer that it is that you're looking for. Okay, Eddie, I'll answer yours last here. Heat seems to be a trigger for me. Being a landscape business owner and in the heat several hours a day, what could I do to minimize things during hot months? As obvious as staying hydrated, but make sure that you're having electrolytes. Can you confirm to me in the chat right now if you actually take electrolytes? Because yeah, like if you're getting overheated and you're getting to the point where you're having heat stroke or heat exhaustion, which can cause heart palpitations, like a very, very, like a strong pulse and chills and fatigue, if that's what's happening to you, then you might be drinking water, but it might not actually be going into your body. So let's get clear on the simple stuff first before we go like crazy town and start making up all these different diagnoses and all these, you know, trendy solutions. Let's go easy first. Okay. Does anyone have any other specific questions before I let you go? Because I said I would keep you for around an hour. I don't want to take up too much more of your time tonight, even though I'm sure we could answer questions all night. I want to leave the links for the programs for those of you that want to try the meditation program or for those that want to try the breathwork program. I'm going to leave the links here. So bear with me for a second. And I'm also going to leave you the opportunity if you want to book a breakthrough call with me. So if anyone wants to talk to me specifically about their anxiety and depression and you want to inquire about Peace of Mind Method and see if it's a good fit for you, that's the link right there. You're going to book a breakthrough call with me. We're going to have a chat and we're going to see what's happening with you and how we can use the tools specifically for what's happening inside your body and inside your experience in order to navigate it better. Because everyone's got a different story and everyone's got different symptoms going on. But at the end of the day, the way that we treat and tackle this stuff is very similar. And I think that we can do that very quickly. If I can hear your story, hear what's going on, and then I can provide you some more pointed advice of how to start working on that kind of stuff. Okay. So if you want to have a direct conversation with me, it's that last link right there. Eddie, I'm seeing you comment right now. I drink lots of water. My blood work says I'm not dehydrated. Let's dive deeper in our call on Wednesday. No problem. Let's do that. And if you've had a breakthrough call with me before, we cannot do a second breakthrough call. I try and keep that very, very strict for everyone in my community because otherwise I would be on the phone with you guys all the time. And that is just the way the cookie crumbles. I love you all, but we can't continue to keep chatting on a one-to-one basis and me knowing your stories because I actually want to help you and get to the other side instead of just hearing your story again and again. Okay. So let's park it there for tonight. If you want any of these specific videos that I mentioned, feel free to shoot me a message either on Facebook or Instagram and I will get it to you. And yes, Chris, it's called the vagus nerve activation inside my YouTube, or you can just send me a message and I will get you that link after this. Sound good? Give me a thumbs up. You are so welcome. Okay. I hope everyone has a fantastic night. If you want me to answer any of your questions in private, if I didn't get to cover them tonight, I'm so sorry. There were a ton that came in and I only had so much time with you. But if you do want me to tackle it with you, send it my way. I will do that. I have no problem answering you after hours and we will speak soon. Okay. I hope everyone has a great night. Ciao for now. And we will speak soon. Bye, guys.